The Ministry of Health will undertake an in-depth study of COVID-19 in order to simplify the country's response to a pandemic should another occur. This was confirmed today by Health Minister Terrence Deyalsingh at the ministry's daily COVID-19 update. More in this report from Khrystal Wilson.
The Ministry of Health will begin a series of studies on the coronavirus and its impact on Trinidad and Tobago. Health Minister Terrence Deyalsingh said given the current availability of clinical data, the ministry will be seeking to improve its understanding of the coronavirus. He said this will prepare this and future administrations' responses to similar emergencies.
What that will do is to help us make plans for the future. It will help us now consider the new symptomology that is presenting itself across the world. One of the newest symptomologies, and the Chief Medical Officer will expand on it, and I'm just raising it here, is something called silent hypoxia. You would have heard last week and 2 weeks ago, new symptoms presenting loss of taste, loss of smell. The Ministry of Health is going to be very proactive by doing this retrospective study of 116 cases, so that when we prepare for future developments, we will have a model, not only for COVID, but a model as to how future ministers of health, ministries of health, future governments can deal with pandemics.
Meanwhile, Chief Medical Officer Dr. Roshan Parasram offered an explanation to a new symptom observed in treating COVID-19 patients called silent hypoxia.
What it's suggesting is that the level is actually somewhere between 50 and 60% oxygenation, and persons can be sitting around normally, no signs of respiratory distress, using their phones, talking normally, but their blood oxygenation level is far below what we would expect for a person in that sort of non-respiratory distress setting.
The health minister said academic paper submissions will also be made to help evaluate government's performance. Mr. Deyalsingh said they'll be looking at factors which include clinical experience, public health mitigation strategies, and effectiveness of the parallel health care system. Khrystal Wilson, TTT News.